Good morning, colleagues. A special thanks to colleagues in the Institute for Public Health who have arranged this conference and have titled it The Commercial and Political Determinants of Health. My name is Norah Campbell. I'm an associate professor in Trinity Business School, and I guess I'm keenly interested in the area of the commercial determinants of health, quite simply because in the 20 odd years or so I have been in business research and engagement, I have not seen a field that approaches and aims so precisely at the problems that we are facing and focuses on solutions that are so robust and evidence-based. Colleagues, I'd like you just for a second maybe to sit back and close. My title of my presentation is Food and Power in Ireland, Problems and Leverage Points. So I would like you just to take a moment to close your eyes and in your mind's eye to conjure up the image that crystallizes for you when you think of the problem of food in Ireland today. So the problem of food in Ireland today. And this might be, or some version of it might be what you see in your mind's eye, this typical mental model that we have with all the built-in assumptions that are there. So we assume it's about the availability of this type of food in our shops, and it's marketing, so it's packaging, it's retailing, it's advertising, that's the blame. The child is the vulnerability, and we need to use our full arsenal of education campaigns in schools, social media, cooking classes. We need to get parents and communities on board to help us, and we must all work together to change it. And certainly the commercial vectors of disease are the mass marketing, retailing, advertising of this food, and it's ever more aggressive. So we're in the middle of what I would call a neurological turn in marketing. That means using techniques and advances in neuroscience and neuroimaging to measure brain activity and emotional responses to food, and a data analytical turn in marketing, eye tracking, footprint analysis, etc. So this is what marketing looks like today. Collaborations with management consultancies, tech companies and brands such as this one, for example, to examine the eye time or the gaze time of product placements like Kellogg's Pop-Tarts. But this is the tip, the visible tip of the iceberg. And what I want to do is to spend my few moments talking to you about the other commercial vectors of the junk food environment in Ireland, besides marketing, and make the case that we need to deploy a different set of strategies, maybe ones that are paradigmatically different to the ones that we are familiar with. So Anna showed us some of the commercial actors that are involved in the commercial vectors of disease. I'll show you, I will amplify that and show you it from a business perspective. She was looking at literature from a health perspective. So this is a typical business standard fare. This is MIT's Slow Management Review, what every CEO needs to know about non-market strategy. So the market environment, many of you who have done an MBA or even in, masters or in management or business 101 will know that companies work in a market environment. You're told that you're in a company, you have competitors, customers and suppliers that all interact in different ways and respond to each other in different ways. A non-market strategy is different. It says actually there's a wider community of audiences there that you must interact with if you're a company or an industry. So it recognizes in the language of this particular article that businesses are social and political beings, not just economic agents. So in management texts like this about the non-market environment and advice on the non-market environment, this is the typical thing that's said. Smart executives engage with their social and political environment, helping shape the rules of the game and reduce the risk of being hemmed in by external actors. So in effect, how do you talk or interact with governments, regulators, journalists, NGOs, activists, etc. So the goal of non-market strategy is the same as market strategy, to increase market share year on year. And this includes all the products that Anna has addressed. And in particular, what I want to talk about and use examples from is the non-market environment of food in Ireland. So the goal of every junk food brand, and I call it junk food, but you can call it any other type of food that you like, is to make food as available as possible, as benign seeming as possible, as cheap as possible, and as desirable as possible. So maybe one of the things that you might come away with today is that you need to know your ABCDs. This is what commercial actors are doing in the non-market environment. And it works. You know, pre-tax profits of Mondelez, which is the distributor of Cadbury's in Ireland, more than doubled between 2023 and 2024. So in order to do that, in order to achieve the doubling of profit, a company or an entire industry must engage in non-market activities to shape the rules of the game. This is a very useful image that I've taken from the Climate and Health Alliance major report on food from 2023, addressing specifically Ireland. And we can see, just to contextualise, that food is, of course, a chain of activities from agricultural production here to distribution, processing, food retail, supermarkets, etc., delivery services, eating, research and technology, and waste and recycling. And there are multiple actors involved. So I guess it's very easy on the ear to say, oh, this is a complex web of interconnected activities and we all must work together to fix it. And maybe what is harder on the ear is that these entities that drive the system, all of these entities that drive this chain, are not all equal. It's precisely the economic actors that I want to talk about, because they don't follow, but they shape the rules of the game in that way I talked about earlier. And I'm going to home in on food processing just simply for time's sake, but not just for time's sake, colleagues, but because processing food in Ireland is where the deepest profit pools are. So there's a real drive to process, and because that's where you get the greatest percentages of profitability in the food chain in Ireland and in many other countries, but in particular this one. So the maybe I will contextualize this slightly by saying there's been a phase shift, as many of you know, in food innovation. Up until the 1990s, we had processed food. So these are foods that we need for safety and to secure food supply, such as tinning, freezing, drying, fermenting, etc., heating, etc. And that's the processed era. And ultra processing is different for two reasons. First, it changes the food on a much deeper level, sometimes a molecular level, using emulsifiers, colorings, humectants, caking agents, anti-caking agents, foaming agents, bulking agents, gelling agents, antioxidants, etc., and flavorings especially. And the purpose of this type of intervention is not to guarantee the safety of the food chain and supply, but rather hyperpalatability. That is a set of economic activities designed to circumvent physiological satiety signals and to activate brain reward circuitry. The second reason why this food is different is also an economic reason. These processes are designed to mimic real ingredients, to keep manufacturing costs to an absolute minimum. So take cheese, for example. Cheese is an expensive processed input material. So of course it makes more sense to manufacture cheese flavorings, cheese powders, etc., because these mimic real ingredients. They keep costs to an absolute minimum, and the flavor of this 14 different types of cheese flavoring stimulates repeat consumption when it is paired with puffs, strings, cheeses, or crisps, crackers, etc. So when you look at one of the major corporations in Ireland, Kerry Group, Kerry doesn't make its deepest profit pools, of course, from manufacturing cheese, but rather from cheese seasonings, flavourings, powders, etc. It's a food ingredients business, the same as Tirlán, Glanbia, all of them, not a farm business. So the vast majority, of course, of government-funded and government-subsidised research and development in food in Ireland is in ultra-processing and these types of activities, something we definitely should come back to in the Q&A. I realise that there's too much information here, guys, to zone in it in any way, but it's one of the most recent umbrella reviews on ultra-processing and adverse health outcomes by Melissa Lynn and her colleagues in the British Medical Journal. Looking across lots of impacts of this type of food on health. And what I find the most interesting is the highest kind of grade and credibility of the evidence is in actually mental health conditions that come as a result from eating this food. Eating this food, whether you're 5 or 50, is fundamentally weakening the population and diminishing the health of the population. So I want to spend a couple of minutes tunneling down on some of the activities that Anna talked about with respect to the food industry in Ireland. So as the major report from the Climate and Health Alliance, as well as many other reports, you see the UCC report by Ivan Perry launched in 2024. So many reports again and again in Ireland saying that there are 15 risk factors for death and disability in Ireland. 11 of them are linked to the food that we eat, and 11 of them are linked to precisely this food that is cheap, available, benign seeming, and desirable. So let me run through some of the non-market strategies that are prevalent in Ireland, from the most obvious ones to the least obvious ones, and then I'll conclude. So the food lobby in Ireland lobbies governments to make their products as available as possible. As you know, Ireland introduced the sugar tax in 2018. Here are some of the submissions that the government received when it opened its consultations. This is Lucozade Suntory, which recommended the exemption of these sports drinks because they were actually designed for elite performance and not for general refreshment. So someone better tell my 15-year-old child that. Or ones that are maybe less funny and much more sophisticated, like the long-standing campaign across lots of non-market audiences and using lots of non-market strategies by Coke, which is aimed at providing people choice. So reframing the mass production and availability of this product as choice and an expression of choice and independence. So what lobbying groups such as IBEC, Food Drink Ireland, or its individual public affairs departments within these companies realise is that their goal is to create what's known in the literature as policy dystopia. So typically what policy dystopia means is warning non-market actors, governments, journalists, etc., of the dire economic consequences that will happen, in particular job losses, which strikes in Ireland, should there be any change in the availability of these products. And policy dystopia is a pattern of lobbying that happens all over the world and has been well documented. I want to draw your attention to this article that is really important, I think, and really gets to the heart of what's happening in Ireland, though it's a global study. And I suppose it's asking us to think about three ways or three dimensions to think of how industries exert power within governments, particularly health harming industries, and I'm talking about food. You have this one-dimensional view or a kind of very basic mental model that we have, this image of lobbyists walking around the Oireachtas. And of course, there's no such thing as a lobbyist. The titles for this type of shaping of the rules of the game are public affairs, management consultancy, business interest groups, or business representative groups. Um, and we have then more sophisticated ways of understanding that maybe get in Ireland. The second kind of dimension is maybe nearer to what happens here, this power to define issues and potential issues. As I referred to in Coke, the Coke example, these long-standing campaigns using public relations, lobbying, journalist content, etc., around shaping choice and the ability that Coke has to shape choice and empowerment. That's known as the power to define issues and potential issues in this country. But more than anything, I think what Lima and Galea, not in particular to Ireland, but for me it strikes a chord, is this type of power that is pervasive in Ireland. The power to avert conflict and to keep conflict latent. What does that mean? It means to head off any potential uprising, outrage, feeling that we've had enough and we are going to have to do something paradigmatically different. That is always kept at bay in Ireland. So, for example, the Advertising Standards Authority last became the partner for Commission Naman. Commission Naman being the state's regulator on advertising. Now, you'd be forgiven for thinking that something as stately as sounding as the Advertising Standards Authority was somehow an arm of state. It's not. It's a voluntary representation group of the advertising industry in Ireland, and it's not a statutory body. So 94% of its funding comes from the revenue of the advertising industry, and 6% comes from industry membership subscriptions. Its 10-member board comprises entirely those representing the commercial interests of the advertising industry in Ireland. So this is what I mean, to get in there early before there's even, it makes the job of discussing power so much more difficult. We have a revolving door government in Ireland. And the concept of the revolving door is simply the migration of individuals between governments. And of course, any TD or anyone working in government when their term is up has to go back and get a job somewhere. So that's absolutely not what I'm saying. I'm looking at data from political scientists north and south of the border here that say about 11% of TDs turn to consulting, lobbying, or corporate board membership, precisely these fields that are shaping the rules of the game. In addition to overt forms of economic power and influence are much more tacit ones. So the food lobby in Ireland has a pedagogical arm that reaches into school curricula often in collaboration often with state departments. So it's going back to this idea that there are different audiences and different channels of influence. You don't go at these kind of overt, conflictual channels of influence. So education is a prime route in Ireland through which normalisation takes place. Take, for example, many examples, but AgriAware. It's an interest group that's predominantly funded by agri-food businesses, and the general public of the importance of agriculture to the Irish food or to the Irish economy, absolutely. So materials on the surface are like this on the surface are laudable, but they are not education. They are shaping of a certain view of food in Ireland that dissuades people from questioning the role of commercial power and ownership within the industry, these profit pools that I'm talking about, or more precisely averts conflict. So it never, in these materials, would you be talking about the physical limits of the nitrogen loading in soil, or you would never talk about the composition of the food sector in Ireland, where, as you probably know, nearly 70% of our food that we farm in Ireland is meat and dairy. The vast majority, I think over 90% of that 70% is exported. So this kind of prevents necessary actions because we internalize the conflict. And as Anna says, we personalize it and make it think, oh, this is us. And it's just a question of becoming vegetarian. Unfortunately, it's not. So food brands don't just compete in the marketplace of taste. They compete in what the very famous business academic and engagement scholar and very conservative guy, David Fogel, calls the marketplace of virtue. Simply appealing to its non-market audiences of journalists, government appointees, community groups and educators. Does this in three ways in Ireland. PR, to change the perception of products or industries through so-called grassroots activity. Journalism, or what's known as churnalism, which is pervasive in Ireland, where we have press releases from Ireland's PR agencies becoming news items on radio, television and newspaper. And partnerships, of course, with cash-strapped community groups where the brand becomes part of the local furniture. As Anna says, there's a predominant insidious and pervasive myth that we are all in this together. But these investments in communities are often small fractions of their profits. So we need to look at the annual reports for these companies and then compare it to their investments. How much does Kellogg's invest in cool camps, for example, compared to its profits? And we can talk about maybe that in the Q&A. So to move towards the end, I want to say that we are moving, I think, in health and in business internationally towards a paradigm shift. So this idea of a paradigm shift has lots of features, but essentially one of the features is the starting point. How do we start again? How do we start and say it's this problem and not that problem? So I think we need to reflect on this starting point as being the wrong one, the old paradigm of overconsumption. We have an overproduction challenge. This is a worrying and systemic feature of oversupply. And in the overproduction starting point, the health policy community would examine the amount of junk food each citizen would have to eat in order to keep the sales year on year going up of these companies in Ireland. So you never hear about food sales going down. So that output of production must go somewhere. Frances Finucane, a colleague, an endocrinologist in Galway, and Catherine Riley, formerly of the Institute of Public Health, and some other colleagues of mine measured the sales of sweets, chocolate, biscuits, savoury snacks and ice cream in Ireland using Euromonitor data. And we find that in order to guarantee just these five categories, each person, each citizen in Ireland would need to eat the equivalent of more than 5 packets of Skittles, 3 standard Mars bars, 7 packets of crisps and 10 digestive biscuits a week. So this doesn't include the fast food industry, the alcohol industry, the frozen food industry, etc. Two slides and I'll finish. Anna says, you know, the 4 A's is only the starting point, but I think we need to, for me, we need to reconceive the 4 A's and bring them far more into the different sectors that we need, the problematic sectors. And so, for example, changing not just the affordability of food at the customer facing point, but making it much harder for industries and companies to produce this food in the first place by using fiscal policy. So, for example, we don't tax enough. We know that. Kerry Group, for example, paid 114 million in 2023 in tax out of a revenue of 8.8 billion. That's an effective tax rate of 1.2%. And many of you will not know that food advertising, marketing and sponsorship in this country is tax deductible. In other words, in order to advertise Monster or Coke or Cocoa Pops or whatever it is in Ireland through sponsorships, cool camps, social media, etc., all of those companies then can claim tax relief on it. So in effect, we are setting up a corporate welfare state through our subsidies. Some of our government agencies, charities, community groups and academic units are starting to change the conversation in this country. And we can see this happening in really strong evidence-based ways. And maybe we can talk about some of these in the Q&A. And what I find so laudable about these examples, many others, is that I think we are coming to the realization that we are better off having done too little at the right starting point than having done more than enough at the wrong one. Thank you.